We're with Rebecca Palpant Shimkets, Associate Director of the Rosalynn Carter Fellowships for Mental Health Journalism. You said that journalists often write about mental illness as though it's happening to, quote, people over there. What do you mean by that?
Well, mental illnesses are highly prevalent. 1 in 4 Americans will experience a diagnosable mental health condition in a given year. When you think about that, mental illnesses impact everyone. It's in every family. It's in every office place. It's in, throughout our communities. But too often, we talk about it as if they are isolated incidents in the most dramatic situations.
Okay, and you said that, how far apart are today's journalistic practices from what you think would be the best practices for journalists to follow? You said there's been some change over time. How much more change, in your opinion, needs to happen?
There have been a lot of changes over the last 20 years. Mrs. Carter has been working on this issue for 40, so it's been pretty dramatic. We now have guides to support journalists reporting on the issues, the AP standards, as well as the Carter Center resource guide. I think we have some work to do still. Some work in terms of balance, telling more stories of recovery involving more people with a lived experience of mental illness in stories as experts, but most importantly, really working on the issue of the association of violence with mental illness that we see all too often in the media.
Okay, now you've also talked about the specific language choices that journalists use. Give me a few examples of what are some of the outdated terms and the outdated ways that journalists are using language improperly.
So first, we really encourage journalists to think about person-first language. And by person-first language, I mean talking about the person before you talk about the illness. Instead of saying someone is bipolar, it's really a person living with bipolar disorder or a person with bipolar, instead of the other way around. In addition, we really would like to see the drastic reduction in use of derogatory terms like wacko, psycho, schizo, that were common decades ago, but increasingly we're seeing diminishing presence of those terms now.
Okay, and also you've talked about use of mental health and health terms in non-mental health ways. Give me some examples of that.
I'm still seeing this and hearing it on the radio and seeing it in television. For example, with the weather. The weather is very schizophrenic today. Well, schizophrenia is a medical term. It's a term to describe somebody who has symptoms that can include paranoia or delusions. And we just have to be careful that we keep health terminology when we're talking about health and weather when we're talking about weather.
Okay, and finally, what exactly is the Carter Center Mental Health Program, and what is your Journalism Fellowship program within that?
The Carter Center Mental Health Program is a program that works on areas of interest that former First Lady Rosalynn Carter started over 40 years ago, back when they were campaigning for governor of Georgia. We work in 2 areas. We work in policy and we work in stigma reduction. In the area of stigma reduction, we have the Rosalynn Carter Fellowships for Mental Health Journalism, a 20-year-old program now that helps journalists report more accurately about mental health issues and more sensitively, helping them produce a body of work that's informed and, as a result, building a cadre of journalists interested in these important public health issues.